Hi, I'm Matt Dalton, and I'm really excited to sit down with Amy McKeown and talk about why health, mental health and wellbeing is going to be the next boardroom issue. Enjoy. So Amy, I'm really excited to have you here today. We're at a time where across the consumer businesses that I work with, there's a lot of people out of work at the moment for health or mental health issues. So what should companies be doing more about this?
Well, I think the first thing is to recognise that health and mental health are issues. We've seen the rise in the last decade of wellbeing and wellbeing leads and wellbeing programs and wellbeing initiatives that have lots of good things in them, but they're not really yet thinking about health and mental health. So I think recognising at the board level that health and mental health and who pays for it and who is responsible for health behaviours is the first step that you need to take.
You make a really good point about boardrooms, because a lot of the meetings I have, it's not a topic that gets to that level. Do you know why that's the case?
I think because we've grown up in the UK with the NHS. So as a nation in the UK, we haven't had really difficult decisions and discussions about who pays for and who is responsible for health and mental health. Like you or I could make ourselves as sick as we wanted through our lifestyle or behaviours, and there would be a free, publicly funded healthcare system that would pick us up. Health in business is often private health insurance, but that's very much seen as an employee benefit for senior leaders. We haven't thought about actual responsibility and payment for health and mental health.
From your experience, Amy, why is this so important right now?
Well, I think health and mental health has always been important. I just think, as we said, we've been lulled into a false sense of security. I think there's three things going on at the moment. Firstly, we are on the back end of a COVID pandemic, so health and mental health has been to the forefront than ever before. We have NHS waiting lists at their highest level that they've ever been, which means that employers and organisations are going to start having difficult questions about how their employees get access to healthcare. Because if employees are waiting 3 weeks for a GP appointment, then that's 3 weeks where they're actually not necessarily efficient, not necessarily at work, they're off the workplace. So we've never really seen the NHS in the state that we're in. And the third point is that we are seeing, since 1992, the highest levels of economic inactivity in the UK. So yes, unemployment is down, but economic inactivity, which means people who are not looking for work but are outside the workforce, are at the highest rates. And that is due to ill health and mental ill health for a number of reasons, but as we recover from COVID. So we're at a position where health and mental health societally have never been so high. In terms of impact on the workforce, it's never been so high, but that the NHS, which has always been the thing we've relied on to help us, is also at crumbling and breaking point. So this is why it's now a board level issue.
There's so much data out there, Amy, at the moment. Are companies using that in an effective way to really measure what they're doing around health and mental health, and could they be doing that better?
In a word, yes, they could be doing it better, and in a word, no, they're not using it properly. So when I work with large organisations, many of them have lots of different data sources that they're not pulling together. So for example, organisations who have private health insurance or employee assistance programmes or occupational health, they can get data from each of their providers about how many employees are using what service and with what before they then design their health, mental health and programme. I don't see this happening. I see us sort of ploughing into well-being through passion, not looking at what illnesses and what things that people are actually off sick with, or using existing providers and then designing prevention and education and health promotion around that. Because if you do it that way, you've then got the ability to look at what impact your prevention and programmes have on the illnesses and absences that your employees already have.
That's really interesting. Now I know you worked with a big FTSE 100 retailer designing their mental health program. What were some of the benefits that came out of doing that the company saw?
Well, the benefits were that employees, accessed the programme, felt engaged, felt looked after, could look at the impact on absence rates, and that there was a structure in place. So when I work with organisations, I start with the foundation often. What are they trying to achieve? What is health and mental health? And how we create a backbone of a programme that you can then over time develop further. So once you've got that backbone, you can over time add new benefits, reprocure your health providers so they're actually fitting the demographics. You can build out and extend your strategy out into how we look after certain groups. So for that particular retailer, there are a lot of women, so how we can bring in women's health in. A lot of organisations are creating strategies that are for people with mental health, but they're not doing anything internally to look after people who've then disclosed mental health conditions. So once you've built the backbone and structure, you can then over time bring in different pieces of the jigsaw and put in different things to support different demographics as you build.
Thank you, Amy, for a really insightful conversation, and I really do hope this becomes a much bigger boardroom agenda item.
Thank you.